I'm thankful to Sentex for inviting me for addressing and presenting my paper. And before that, I would like to show that how the food is the medicine. Actually, in Hippocrates, what we call the father of the modern medical science, he says that food is the medicine. Similarly, Charaka, the founder of Ayurveda, he also says that food is the medicine. Ahari Paramaushadam. So in this regard, I would like to show you 1.5 minute video on the food.
What is Neo-Ayurveda? First time in the history of Ayurveda, Dr. S.M. Raju blended allopathic medical science with Ayurveda. Like in allopathic science, taken the principles like diagnosis, dosage and administration, blood thinning, cholesterol maintenance, rejuvenation of gut beneficial microbes, and from Ayurvedic science taken the medicinal herbs to nourish the undernourished organs, and diet, meditation for activation of hypothalamus gland and other endocrine glands, and pranayama for lung exercise. By studying through Vedic literature as a passion for more than 40 years. Unlike traditional Ayurveda, Neo-Ayurveda pioneers specific diets and treatment plans with health supplements for various incurable health disorders. In Ayurveda, purified metals are being used in many formulations. Neo-Ayurveda opts for herbal extracts. These medicinal herbs rejuvenate organs by clearing blockages in tiny blood vessels and are connected to cells for supply of nutrients, hormones, and oxygen, for nourishing while aiding in removal of toxins and carbon dioxide. A unique aspect absent in current medical science. Crafted from Vedic literature, Neo-Ayurveda created 30 unique and 100% herbal formulations, excluding purified metals, out of which 10 formulations in combination address more than 170 incurable and chronic health disorders. Like in allopathic science, blood thinners, statins, beta blockers, omega-3, omega-6, fatty acids, and supplements. In Neo-Ayurveda, as per Chakra Ahar Hai Parama Aushadam, the approach is, the food is medicine, as per Greek physician Hippocrates, let thy food be medicine and medicine be thy food.
See, now I am presenting the paper on this chronic kidney disease due to diabetes mellitus. That's what we call diabetic nephropathy. This is the biggest issue in the world right now. Once, according to the current medical science, it says that the EGFR rate, estimated glomerulus capillary filters, if it is less than 15%, there is no science other than the dialysis or kidney transplant. Especially for the people who are below poverty line and the middle class family, it's a dream to get kidney transplant. So in this regard, I am addressing, basically I am an IAS officer, Indian Administrative Service Officer of India, and retired in 2020, and I have in a passion developed this new Ayurveda science since 1981 when I was in third year graduation to till date. And now when the current medical science do not address us, so in that context, the science which I have developed by blending allopathic principles with Ayurveda, which will address us, except in motor neuron disease, muscular dystrophy, and vitiligo. I have not seen any much results. So now I will address you in the step by step. Next slide. Next. And now, as I told you that necessity is the mother of invention, I had a rheumatoid arthritis and I used to get 6 lakh unit periduro injection when I was in 13-year-old, and thereafter it was enhanced to 24 lakhs units by the time when I reached in a college in 3rd year, and 12 lakh unit periduro injection used to be injected in each hip. Sometimes it never used to be injected in one go. So every 21 days I am supposed to take. As the medical science used to say that Staphylococcus will lick the joints and suck the heart like that. So doctors used to say that lifetime I have to take. So at that moment, it's my luck, it seems to be, medicinal plantation course was introduced as a routine curriculum to us. So then I have studied and experimented on my body and I got cured. And thereafter I can say that it's luck that my father had a kidney failure and he was on dialysis. Otherwise I could have not invented this science now. And again in 2008 I have experimented on his body. He was on dialysis and he could be able to come out within 3 months after inducing my therapy. Thereafter, that's also I can say that it's luck. My son had a blood cancer and right now he is in this conference. That's acute menal leukemia and he was undergoing treatment in CMC Vellore, Christian Medical College Vellore. And along with the allopathic medications, without the knowledge of the doctor, I induced my science on him also, and he was so speedily come out from the AML, and even doctors were also, amazed to see that resultant effect. And thereafter, since I was in a very coveted service, I could able to treat many top people like honorable union ministers, honorable judges and honorable chief justices and all, and they prompted me that why can't you bring this science to the public? Otherwise I never thought. So next slide. Now, nutritional healing. Food is the medicine, because the reason why all the diseases are prevailing, since as we are having more than 80 organs and these organs are having different roles. The current medical science doesn't know that all the organs are the roles and responsibilities and the type of hormones are being released. And now if at all any particular hormones get disturbed because of the undernourishing of that particular organ, then automatically due to the cascading effect, the particular health disorders will start. So like that, here in the chronic kidney disease, I would like to say that some nourishment is not being taking place. So therefore, the kidney is getting dysfunctional. And whereas the same similar principles, if at all pancreas get dysfunctional, as you know that pancreas is having two roles. There is an exocrine role and endocrine role. In exocrine role, if the lipase and amylase get disturbed, there is no science in the world to correct it. But whereas in endocrine gland, if there is any disturbance like insulin productivity and all, therein artificially we can induce insulin. But wherein in my science, even if there is a disturbance in the exocrine gland, if the lipase is 2000 plus and amylase is 8000 plus, if the patients who are on intravenous food, such patients also will come out from the problem within 15 days. And the resultant effects can be seen within a week. So this way, this new Ayurveda, what I am explaining now for the kidney disease, it is. Now I would like to tell you, what is the current medical science? Because you all of them are here, the top doctors and professors from different colleges across the globe. And now, right now, up to the arteries level, there is a science by way of, through angioplasty and through stent and through grafting. But whereas when it comes down from arteries to the capillaries, the artery size, as you know, that 15 mm to 25 mm or 30 mm. Whereas it comes down to the capillaries, the size is 1 micron to 20 micron. For 1 micron to 20 micron, 1 micron is 1 by 1000 mm. There is no science in the world to stimulate and ensure the